And right now, we are honored to begin with Professor Keng-Li, the Director of Heavy Particle Therapy Department at Taipei Veterans General Hospital, TVGH. Professor Lan will share his expertise in irradiation therapy and heavy ion therapy in a cancer treatment, a cutting-edge approach utilizing a particle technology to precisely target tumors. Please join me with Professor Lan. Okay, no.
It's my great honor to share with you our experience in cancer treatment with carbon ion therapy. And I apologize for the topic. This will be focused on many cancer types, not just limited to pancreatic cancer. But pancreatic cancer is one of our most important indication. We are very fortunate to become the 14th center in the world. And this is our center, and this is the interior, the synchrotron room and the treatment room. We have AB2 treatment room. This is a layout of our center. Currently, this is synchrotron, and we have 2 treatment rooms, and we also save a space in the future to house a rotating gantry. Okay. And this is synchrotron room before and after installation of the accelerator. We have 2 treatment rooms. Each room has a vertical beam and a horizontal beam. And this is I'm sorry. Okay. This is, we have a mandatory clinical trial requested by our Taiwan FDA, and we treat 6 patients with head and neck, lung, liver, prostate, and sarcoma. And the primary endpoint is to monitor the acute treatment-related toxicity. The second endpoint is to demonstrate our capability to deliver this treatment. Okay. There are 3 characteristics of carbon ion therapy. The first one is a good dose distribution. Second one is a superior killing effect on cancer. The third one probably is the most important and most unique feature of carbon ion therapy is to overcome hypoxic tumor. Why do we care about hypoxic tumor? Oh, okay. The scientific background behind carbon particle therapy is based on the finding of William Bragg, the Nobel Prize laureate. The particle will release most of its energy at the end of the traveling path, so it can deliver into the tumor and without minimize damaging to the surrounding tissue. And next slide will further demonstrate this phenomenon. For conventional photon therapy, the radiation will pass through the normal organ, and there only a fraction of the radiation reach the tumor. However, for particle therapy, the Bragg Peak will describing a phenomenon that most of the energy will stop in the tumor and spare the normal organs. The other important feature of carbon ion therapy is that the carbon ion can make a double DNA strand break, and this causes the DNA damage very difficult for cancer cell to repair. As opposed to photon and the proton, they most likely create a single strand break, which is easier for cancer cell to repair. And the most important feature for carbon ion therapy probably is the fact that it will treat hypoxic cancer more efficiently than photon and proton. Cancer cell deal with the oxygen availability. This is a very important field of medical science. In 2019, a Nobel Prize was awarded to these three scientists who make a great contribution to this field. Here shows if you use conventional photon therapy, if you want to achieve a certain degree of cancer killing in the normoxic environment, you use a lower dose, but you need to increase the dose substantially in the hypoxic environment to achieve the same killing fraction. For carbon ion therapy, the difference in hypoxia or normoxic environment, the killing efficiency is very close. So that's so-called low OER. Why we care about hypoxia? Because tumor growth, malignant tumor will grow very fast, and the central part will become necrotic, and some of the cancer cell will die because due to the lack of oxygen and nutrient. But some of the hypoxic cancer, they will upregulate hypoxia inducible factor, which is a transcription factor, and this will upregulate very many important genes, including angiogenesis, helping the survival of cancer. And it also trigger migration and metastasis and suppress immune response. Therefore, hypoxia is really a leading cause of the cancer hallmarks, and many of the malignant features of cancer are contributed by hypoxia. Okay, and Dr. Shinoto and Japanese group, they showed a very good result of carbon ion therapy for pancreatic cancer treatment. And overall survival and progression-free survival is much better than the historic number. Therefore, for example, the median survival time is 25 months, which is compared to the historic number using photon or proton, it's about 9 months to 8 months increase of the patient survival. So based on the literature, the carbon ion therapy plus chemotherapy, it can achieve 1 year survival about 70–80%, which is much better than conventional photon. Therefore, a randomized trial was proposed by UT Southwest Group, and this trial will involve 10 centers in the world, and it's a randomized trial to demonstrate whether carbon ion therapy would be better than photon therapy to control pancreatic cancer. But this trial was not conducted due to COVID pandemic, because this trial involving sending patients around the globe for treatment. Okay, so tumor microenvironment is very complicated, and there's we need to not just kill cancer cell, we also need to kill the supporting cells which promote the survival and the malignancy of the cancer cell. Okay, so we really need some potent treatment to eradicate everything within the tumor. And this is the first patient we treat for pancreatic cancer. This patient had photon therapy before, but however, the tumor growth causing the tumor bleeding effect and the threatening, it's become life-threatening. So we treat this patient with only 5 fractions, with only 1/4 of the normal dose we deliver to the patient. And here shows very good, rapid and very good response for this patient. And afterward, we treat a couple, more than 100 pancreatic cancer patients. And these are some examples. For example, this patient has a huge pancreatic cancer, and this pancreatic cancer very malignant. You can see the central part of necrosis, and the size of tumor relatively large. And after 4 months, there's no SUV uptake and indicating a very good tumor response. However, after 9 months, tumor recurred. And this patient, at first, there's a very dramatic drop of tumor marker. And 9 months later, there's an increase of tumor marker. So it really tells us the importance of the post-carbon ion therapy surgery might further enhance the patient's tumor control and the survival. So we have patient, this is a patient, pancreatic cancer patient, treated with carbon ion therapy. And then for this type of cancer, because the tumor is moving, so we use so-called respiratory gated treatment. We irradiate the patient when the tumor and the normal organ, their movement is minimal. So, and during this respiratory phase, we fire the carbon ion. Okay, so this patient has also shown very good tumor response. And this patient received the surgery by Professor Shi's group. In the histologic study, there's a regression score is 1, which means there's only single cell, a very rare group of cancer cell identified. This is 2 months after the irradiation. Okay, so this is another patient treated with carbon ion therapy, pancreatic cancer, also show very rapid tumor marker decrease. And so she received surgery, and this time, this patient received surgery, and after 1.5 years, there's no signs of recurrence, and she enjoys a good quality of life. Other than pancreatic cancer, we also see very potent effect of carbon ion therapy for different type of cancer. For example, this tumor is a large lung tumor, and after after carbon ion therapy, 4 months later, there is no significant SUV uptake, indicating a very good tumor response. And this patient is for liver cancer. Okay, and liver cancer patient shows very nice drop of tumor marker alpha fetoprotein. So as Superintendent Chen previously mentioned, we already treat more than 500 patients, and so this may mark the 2-year anniversary for our carbon ion center. I'm sorry, this jumping. Okay. Most of patients are pancreatic cancer and followed by prostate, liver, and lung. They account for like 90% of all the patients. Okay, so we organize the data and we submit to Green Journal, which is the best radiotherapy journal. Right now it's under review, and we get response, quite promising response. And this patient, almost 40% of them has oligometastasis. So we treat some patients with very advanced disease, not just locally advanced. And these patients, for M0 patient, the overall response for 1 year is 87%, and the local failure-free survival 91%. And for metastatic patient group, their local control is 100. So total amount of patient with tumor-free local control is 94%. And we analyzed the dynamic of the tumor marker and the response of this patient. The bottom line is we need to treat this patient as early as possible. And for example, this group B patient, they have a good response in chemotherapy. And then if the effect of the chemotherapy plateau would increase tumor marker, then this patient will have I'm sorry. Let's see. For this B and C has good response, but for group B, they have better response. So the bottom line is we need to treat the patient as soon as possible once the chemotherapy shows efficacy. Lastly, I would like to switch gear, talk about the future of carbon ion therapy, because right now, more and more immunotherapy is helping the patient. And these two are very good companion, because we know there's an anti-cancer immunity is a complex cycle. And carbon ion therapy can really destroy cancer cell very efficiently. And afterward, if that trigger immune response and then we combine with immunotherapy or cell therapy, there should be a better long-term control for this type of patient. As indicated by the literature, after the approval of immunotherapy, there is a lot of paper published regarding radiotherapy combined with immunotherapy, and also increased publication about abscopal effect, which means after irradiation, the non-irradiated tumor also show response. Okay, so I will skip this slide and go to the acknowledgement. And this, without the help from this philosophist, we cannot have this carbon ion center. Professor Chen shown here was vice superintendent then, and this is groundbreaking ceremony. Chairman Ying, his group, he donated $50 million and helped us to build this center. Without his contribution, there would be no carbon ion center for here in Taiwan. And Madeline and her family has made a significant contribution, financial contribution, and really jumpstart this project. And we are grateful for Professor Chu Ji, who helped us more than 1 decade. And this is our delegation from VGH to QST. And also, we would like to thank QST, the successor of Professor Chu Ji, Dr. Kamada and Dr. Noda. They and the Osaka the superintendent of Osaka Highmark, Dr. Fujimoto and the Takasuji, they help really shorten our learning curve. So I would like, I conclude my talk. Thank you.